Okay, we're going to move to our next presenter. And our next presenter is Ellen Ethreim, and Ellen did her practicum with Dr. Aaron Langruth, who's one of our faculty members at the University of Montana. And the name of Ellen's presentation is Montana Healthy Places Index. I'll let you take it away, Ellen.
Yeah. Hi, thank you. Like Lee said, my name is Ellen, and I did my presentation, or I'm doing my presentation on the Montana Healthy Places Index. So what is the Montana Healthy Places Index? It is essentially an interactive map and centralized database that serves as a place where anyone can go to get visualizations or information on the indicators that combined help to create and promote a healthy community. It is loosely based on the California Healthy Places Index, which was a project by the Public Health Alliance of Southern California. Oh, sorry. Here we go. And so, yes, sorry, like I said, it is loosely based on that project and hoping to get similar information on Montana. Here are the foundational competencies that I hoped to gain during this project. I used ArcGIS Pro predominantly in this project to analyze, sort, gather, and create the map for the dashboard that you'll see, and also the concentration-specific competencies. So the index is comprised of 23 different indicators displayed here, and each of those indicators are broken down into different indicator groups. And those indicator groups are clean environment, community conditions, education, healthcare access, housing, social, transportation, and economic. Those indicator groups were chosen because they've been recognized to be drivers, social drivers of community health. So when these indicator groups are doing well, it means that the community is more likely to be healthy. Here is the dashboard, a display of the dashboard. You can see that the indicator chosen is the per capita income. You can see right up there. So there's a few different ways you can use the dashboard. There's 3 different geography levels: census tract, county, and zip code level data. So to see that data, you just select which geography level you would like to see it at, and then click the census, in this case, census tract that you would like to see more information on. You can see that this tract is selected here. Once that is selected, the other fields will populate automatically. So you can see the per capita income, the population, population per square mile, and also the demographic breakdown of the census tract that's been selected. Looking over at the map, you see the different colors, the darker blue being the higher that indicator level has scored. In addition to being able to view the data, you can also download data directly from this dashboard. This is really useful so you don't have to go to all the different sites, whether that's the American Community Survey, census data, or others, to get all of this information. You can actually just go ahead and download it with this symbol here. Explain each indicator group a little bit further. This is an example of the economic indicator group. So there's 3 indicators that make up that group: above poverty, employment rate, and per capita income. As you can see here, these are the maps that are displayed when you select each indicator group. And you can see that each map is a little bit different. So then all of those combined create the map for the specific economic index. This is overall how each one of these communities is doing economically. Each indicator group has an index that represents how healthy each community is in that respective area. So each one of those indicators is weighted equally in a formula that then creates essentially a score for each community that is mapped here. So who can use this dashboard? It was designed with local government, nonprofits, healthcare providers, and local organizations in mind, but ultimately anyone can use this dashboard. It was designed to be easy to use and have a variety of uses. So you can use it simply to visualize data, get more information on your specific community, see what other communities are doing, or anything like that. It can also be used on an already existing website. So you can add this dashboard, an organization can, to their website. That way it can supplement the services they provide or the information that they provide. Anyone using their services can go on and see the situation in their community as well as whatever information is already there. I learned a lot throughout this project, and I think this has potential to really have components added to it as we go. As of right now, there's just indicators, but this mapping process could also be really useful to understand things like wildfire risk or drought risk, things like that, as well, to determine the risk levels of certain communities. I think Montana's communities have a variety of conditions that allow for a healthy lifestyle, and this map helps understand that landscape and allows for people to expand on areas that are in which we're already doing well, and then also improve on areas that are lacking. Brief mention on my community and professional service. I volunteered at the Fork and Spoon in Bozeman, which is Montana's first pay what you can restaurant. It provides warm meals in a welcoming environment, regardless of ability to pay. I think this service or this organization goes very well with the Montana Healthy Places Index because it highlights the positive rather than the negative health side. So it really shows what a community has and the assets it can offer rather than the other way around. I just want to say thank you to everyone who helped. Dr. Erin Landguth, forgot to mention that at the beginning, and also Professor Taggart, thank you so much for all of your help throughout this entire process.
Thanks, Ellen. Great.